Welcome back, everyone. For today's lecture, we're going to talk about intro to medical terminology. First, let's take a look at the competencies. With medical terminology, we need to be able to use the foundation, anatomical, and medical terms and abbreviations in both written and oral communication, not only with colleagues, but with other healthcare professionals. This will become important when we talk about documentation and how to document this run report, as well as giving communication or engaging in communication about patient care with receiving facilities, additional agencies that may be on scene, or your partner's ambulance. EMTs need a working knowledge of medical terminology. They really need to understand the key terms, symbols, and abbreviations commonly within the EMS profession. We determine the meaning of an unknown word by first understanding how those terms are formed and then learning each of the definitions on how those terms are formed and what each of those terms. Understanding that medical jargon leads us to effective communication. And the word jargon here is just used to refer to professional language within any profession. The medical jargon would be language that's used with the medical profession, just like engineering has their own jargon, composition or writing have their own jargon. So jargon is just used to refer to that professional language. So first, let's break down what a medical term is and what are the parts of a. So each medical term is broke down into three distinct parts. You have the prefix, the suffix, and the root word. And these specific parts each mean something. And we'll talk a little bit more about what those words mean or what those components of the words mean in subsequent lectures. But first, we need to understand what that prefix, that root word, and that suffix is. And the other important thing to understand is that changing any one of those parts of the word ultimately changes the meaning of the word. So, for example, if we're talking about ant in interior, that means in front of, as opposed to post in posterior, meaning behind. So, just by simply changing that prefix, ant to post, we've completely changed the meaning of that word. And subsequently, this can lead to communication problems or confusion when we're talking about specific components of the patient or directional terms with the patient or where something may be. So it's important to understand. So the components that comprise that medical term, we said earlier, are the word root, right, the root word, the prefix, and the suffix, and then we have some combining vowels as well. The parts and terms are combined to determine a word's meaning. Accurate spelling is essential. For example, phasia means speaking, ASIA, while phagia, PHAGIA, means eating or swallowing. Phasia means speaking, phagia, eating or swallowing. Those are very different words, and if we combine them, one example is to combine them with the prefix dis, which is difficult or painful, or dysphasia means difficulty speaking, and dysphagia means difficulty eating or swallowing. So we can see how things would get confusing there if we were to mix these words up. Even if they sound the same, it's important that they're accurately. All right, so it's also important to understand some basic knowledge of anatomy and in the context for how these words are going to be used, because we also have directional terms. Like I spoke about earlier, things like anterior versus posterior, or inferior versus lateral. Okay, make sure we have a good understanding of that. The word root is the main part or the stem of the word. It conveys the essential meaning of that word, and it frequently indicates a part of the body. For example, cardio, indicating the heart, or pulmonary, meaning part of the lungs. Okay? We can add or change a prefix or suffix to change the meaning of the term. So, for example, cardiopulmonary breaks down into cardio is a root word meaning heart, and pulmon is a root word meaning lungs. And when we combine those together, cardiopulmonary, we're talking about both the heart and the lung. Prefixes appear at the beginning of the word. They usually describe a location or intensity. And it gives the root word its specific meaning. Suffixes appear at the end of the word. They usually indicate a procedure, a condition, a disease, or part of speech. So, for example, the suffix itis, inflammation, the disease process that's occurring we talk about where that root may be. So, for example, conjunctivitis, word conjunctive, conjunctiva, identifying itis, inflammation thereof, or inflammation of. Combining vowels are used to connect root words and suffix with other root words. In most cases, it's an O, but it can also be an I or an E. They're used when joining a suffix that begins with a consonant or joining another. In the next lecture, we'll talk a little bit about what some of these common prefixes, root words, and suffixes are.